amazing. And are there any cases from your private practice or from terminally ill patients at the hospital that really stand out to you as like, wow, that was an
Okay.
incredible case and homeopathy just blew my mind?
So let me give you one example. So about 17 years back, I had a man who had undergone 3 surgeries of cancer of the tongue. So he had a first surgery when he was diagnosed with cancer of the tongue, then it recurred after 1 year, then it recurred after 3rd year. And then when it recurred on the 4th year, he was tired because all his neck was totally dissected. The cheek was removed, the jawbone was removed. It is what is known as commando's surgery, where we do dissection of the muscles of the neck and we do dissection of the lymph nodes in the neck. And it was such an ugly face that he comes with a recurrence of cancer. And he did not want now to do anything to do with radiation. Of course, radiation will not help him, or chemotherapy. Again, this will not help him. The doctor said you should go for 4th surgery. He comes to me. In the beginning, I treat him locally for his cancer and then constitutionally with carcinosin. 17 years follow-up is there and there is no recurrence of his tongue cancer.
Wow.
So I have some long-term cancer patients also who have survived, but the percentage is very, very low. So not to rave about that I can cure cancer. So today if patient comes to me, I honestly say that I have no skills so much to cure your cancer, but I will try to give you some relief or I will do palliation. So I don't speak more about my skill because I'm still developing or sharpening my skill. Let's say that honestly.
That's amazing. And how humbling for us to hear that. Because how long have you been in practice? You've now been in practice for...
So this is my 38 years. I finished
Wow.
37 years with integrating homeopathy with modern medicine.
And to hear that you, after 38 years, are still sharpening your skills, it allows us to feel, you know, us young docs and young practitioners, a whole new sense of, you know, we have lifetime work ahead of us.
Absolutely, because see what happens is that simply speaking has no meaning. Huh? You have to show results and we are tackling human lives. Huh?
Mm-hmm.
So you have to be very, very careful of what you say and what you write. My PhD thesis, I am converting this in a book form, which is right now going to be published by BGen Publishers. In that I have given some cases, in that I have given some new therapeutics which I have developed of cancer remedies.
Amazing.
Yeah.
So even right now, as we're chatting, it's 7:30 in the morning your time, and you clearly are a highly motivated, highly passionate person. And what is the thing that drives you?
The thing that drives me is the challenge. Because see, right now in next 10 minutes, I leave for hospital. I have my outpatient department. And
Wow.
every day it is a challenge. What kind of case will come to me? And how am I going to solve this with homeopathy? So, and every day I get requests from intensive care unit. This person is dying, that person is dying. Can you come and save? Can homeopathy help in heart failure? Can homeopathy help in brain embolism? So all these things comes to my mind, and then there are no therapeutics in front of me. So what I have to do is I have to do trial, error, research, use something new. If I get result, I write it down in my diary and then use that information for the next person. Just 5 minutes back, I got a call from Toronto, Canada, where
Mm-hmm.
one homeopathic doctor is crying and she's telling me that my grandchild is suffering from Henoch-Schönlein purpura, a very
Mm-hmm.
rare disease in pediatric age group. And the doctors wants to give some strong medicine for that. And I want homeopathy. So I said, okay, let's send me some important symptoms, send me some photograph, this, that. And then I just gave the child sickle core. So I work round the clock. I come to my clinic at 5 o'clock in the morning.
Oh my gosh.
Yeah, I come because I have to work round the clock because I receive queries from all over the world to help people with advanced pathology. And if it works, then I feel so happy, and that's my motivation.
Wow. And what
Yeah.
advice would you give young practitioners, young homeopaths, as they're starting their careers and
What
stumbling
I
into
would
practice?
I would say is that first we should have a very sound knowledge of basic homeopathy. Many homeopaths miss that information. I know in America there is no proper training for homeopathy because you have weekend courses or monthly courses, no proper schools. So I can understand the plight of a homeopathic student in United States. But in India, we have got a full-time course for homeopathy. But unfortunately, most of the homeopath, even after doing 4 years of course, are extremely unskillful. And that really pinches me because they have not studied their organon, they have not studied Hahnemann. Half of them run for new methods, half of them went for shortcuts, half of them wants to do pathological prescribing or specific, half of them want to do combination medicine. The road of selecting one remedy for the patient is really difficult, but it is very challenging. And once you get the result, I think so you don't want to give it up. So this is
Mhm.
what I would say.
And to go back to those basics, really feel
Yes.
solid in the organon, really feel solid in.
So, yes. So in most of my seminars that I teach worldwide, people ask me, what new, what new, what new? And I said, first, learn old things from me.
Yeah.
Before you do research, do search.
Yes.
Search is more important before you begin research.
Yeah.
And so I never teach anything which is modern, anything which is shortcut. I say, no, you have to first be a donkey, then you become an elephant.
Well, and I think that's such a part of human nature, right? Is we're craving the new thing, the different thing, the whatever thing. And when it comes to health, when it comes to healing, when it comes to homeopathy, is the foundation, starting with those roots, the
Yeah,
simplicity of that work.
yeah, yeah.
Yeah. So tell us about you've got a bunch. You're an amazing author. You have so many prolific. You have so many books available, and got some phenomenal books in Radar Opus itself. And would you share with us, just newly available in Radar Opus is Lax in Homeopathy? Would you tell us about your book and the
Okay,
information in there and how it can add
okay.
value to our practices?
So that was a phase in my life where I used to teach a lot in Holland. I had given multiple seminars in Holland thanks to our distributor of Radar, Mr. Rene Otter. He organized chain of my seminars.
Yeah,
And
Renee's
then whatever my seminar notes were there, he helped me to gather all my notes and put it in a form of a book. Uh, when I started teaching lac remedies were not very popular in homeopathy. Let's put it that way, excepting lac caninum. Hmm. And then when I studied Jungian psychology, when I studied the psychology of a child, psychology of a pregnant mother, the emotions of pregnant mother entering the fetus, I found out that it has lot of things to do with lac remedies. So lac humanum, lac maternum, lac leoninum, lac falinum. And so I started analyzing the emotions state of all this remedy and compare with the patient who is sitting in front of me. I had one very bad case of biliary atresia, childhood malformation of the biliary system. And the child went for Kasai procedure. It is known as Kasai procedure, where they repair the biliary tree. But then the child is highly prone to cirrhosis of liver in future, and by the time they reach about 14 years 13 years, they develop liver failure and they die unless you go for a liver transplant. Now in India, liver transplant is costly, people don't have much money. So one such child came to me at the age of about 3 or 4 years. Do you follow?
hmm
And then I started treating the child, understanding the state of mind of the mother.
Hmm.
And I found out this was a lac leoninum case. I gave lac leoninum to the child. Today the child is 18 years old without hepatic failure.
Wow.
Yeah. So I have recorded the whole videos and I have recorded the follow-ups and all those things. So lac remedies are extremely useful if you apply it correctly. And I have given some themes, some understanding, not of all the lac remedies. I don't have experience of all the new milks, but whatever little bit information I had learned, I have put it into the book. It is in German about third edition, and in English there is a second edition running. But now I don't think so I'll write a new edition because it's all over. Now I'm in a different phase of my life treating cancer patients. So I would rather write more on cancer remedies.
Hmm. And you mentioned that there was a phase, because you also have the book, The Clinical Observations of Children,
Ah, good.
and yeah, your pediatric practice and
Yeah, yeah. So what happened was that I don't like people who cut paste and may write a book because such kind of materia medica is available a lot by dozens in India. People just do cut paste, copy from 5 authors and then put it into the practice. So this is what I don't like. So what I did was I never wrote a book on materia medica. Why? Because materia medica should be one which you have experience in your practice, which you have clinically verified in your practice, but there are 5,000 remedies. How can I have experience of so many remedies?
right.
And so what I thought was that 10 cases treated with one remedy where the pathology has been reversed, that is the materia medica of the patient, because 10 such good cured cases. But then 10 cured cases of calendula, I have to wait for 10, 15 years. Calendula case does not come every day in my practice. And so when I finished my 30 years of practice, I was able to collect only 61 remedies out of 5,000.
Wow.
And I wrote it in the form of a book in pediatrics, that who can be the father of a chamomilla, what can be the mother of chamomilla, what can be the cradle symptoms of chamomilla, what can be the pre-nursery symptoms of calendula, and all those, stages of a child.
So the clinical observations
Yeah.
of children's remedies is based on 30 years of your practice,
Yes.
your clinical. Wow.
Yes. Yes.
Wow.
Just what I saw. What was the auscultatory finding? What was the finding on examining the posterior wall of the pharynx? What does the nose look like? All those minute details. And
So
then
important. Oh my gosh,
yeah.
that's so amazing.
Yeah, but this is my work. Then nobody can say, oh, this is from Kant and this is from Hahnemann. You follow?
Right.
Because when you write your book, it should be your work.
Right, right. And these are things that you are collaborating with Frederick on and including in synthesis as you.
Yes,
Oh,
yes.
good, good, good.
And now the second edition of, or the third edition of pediatric book, I don't count the editions, but it is coming out next month, where I have added 6 more remedies after 7 years.
Woo!
6 remedies in 7 years. I don't like to share something which I am not very sure about.
Yeah. Well,
Hmm?
yeah, that's amazing, and we appreciate that.
Okay.
Yeah, and I know you have to run
Yeah,
to the hospital. I
I need to run.
cannot thank you enough for taking the time. I know how busy you are, and sharing your history and your path, and for all the work that you do for homeopathy. It is amazing. Do not lose the juice in the battery because we need you out there doing the work that you're
Of
doing.
course, of course. Okay. See
So
you, my friend.
thank you,
Bye
Dr.
bye.
Master.
Bye bye. Talk. See you.
Bye bye.